Welcome to the 2009 Leadership and Advocacy Conference. This year's conference is called Transformative Times, Transformative Leadership. We are definitely in a time of change, and as the thought leaders of the college, you are here to help effect change that helps emergency medicine. To make change happen for emergency medicine, we need to have an effect on Congress, we need to have an effect through the media, and through our donations to our PAC. And that's how we will affect change for our specialty and for our patients. So my challenge for you, and you saw this in Chicago, we have to have the largest medical PAC. We have to have a record number of media hits because that is what brings us the public and our votes. We have to pass our bill. And we have to make sure that emergency medicine is a fundamental portion of the healthcare reform debate. We are the group of people who don't take no for an answer. Okay? We're the group of people that will roll up our sleeves and make things happen. And so you as the leaders of the college need to step up to the plate, and we need to make things happen. So what are the issues that we're facing currently? You know the usual. And the most important one, the failure of emergency care to be included in all the discussions about healthcare reform. So those are the things we need to address. Okay? And I understand that this is probably the worst financial time since the Great Depression. And I understand we're not going to get a bailout like the banks, or the auto industries. We're this group on the bottom. We're the small business owners who've worked hard and done everything right, but due to the economy, our business is failing and no one's giving us anything. As a leader, this is what you need to do. You need to interact with your local media and get emergency medicine stories out there. You need to engage your legislators, both locally and nationally, and get them to be interested and concerned and supportive of emergency care. And when you go there, it really helps if you're able to take a check from NEMPAC, and we can only do that if we have money to give. So we need everyone to contribute to NEMPAC. And we need everyone to continue their ACEP membership despite the fact the economy is bad. We need every emergency physician to be a member. So I'm asking for everyone in this room to not only do this themselves, but when you leave here, to go home and get all your colleagues to do the same thing. Because if all 27,000 of us start pulling in the right direction, there's no limit to what we can do. There's absolutely no limit to what we can do. Okay? Think about it. 40 years ago, 8 guys in a room in Lansing, Michigan, created emergency medicine. So it's up to us to cause change. It's up to us to create the future we want to see. It's up to us to advocate for our patients and for our specialty. And it's up to us to get our bill passed, to get our message out to the media, and to support NEMPAC. So, thank you very much. Enjoy the rest of the conference.